Hey, Dr. C here with you. So how do you optimize your thyroid medication so that you can feel your best? This is a super important topic. There's a lot of steps to feeling better, and some of the steps are not easy. Diet, lifestyle change, these things take time. They can be hard to stick with. And along the way, most people are taking pills for something. Pills are not hard to take. But the right thyroid medication versus the wrong thyroid medication can be a really big deal. It could be the difference between like a lightning bolt and a lightning bug. Forgive me, but that's from Mark Twain, not from me. Uh, so it's important to get it right. This is an easy part of your treatment, and yet it can be super helpful or super harmful. So let's talk through this about how to really optimize your meds so you can feel your best. Now, the first question to answer is whether you need thyroid medication. Here's the thing. It's been argued that upwards of 85% or more of people on thyroid medication don't need them. They were never really meant to be given them to begin with. And, guidelines have changed. So someone could have been following past guidelines when they were put on medication, but now we know better than that. And if you're on them unnecessarily, they can cause symptoms and side effects, even if your levels are perfectly normal. So in the journey of optimizing your meds, we'll talk about this versus whether they're needed or not. So who definitely needs them long term? Well, those that don't have the thyroid, those whose thyroid was destroyed by radiation, intentionally or otherwise, and those whose thyroid glands have shrunk down to pretty much nothing. This is called Ord's disease. It's kind of rare. So they definitely need medicine. They need them long term. Who might need thyroid medication? Well, those who have overt hypothyroidism. We define that as an elevated TSH in conjunction with a severely low T4 level. So TSH like in the 30s or 50s and a T4 that's non-measurable. In some of those cases, not all, but in many of those cases, thyroid medications are needed. So when are medications rarely needed? That would be subclinical hypothyroidism. And that's any kind of an abnormal elevated TSH, but T4 are still being produced. And then lastly, who just doesn't need thyroid medication? That's those who have suboptimal thyroid levels. So anything besides those who require, or maybe rarely, there's a lot of other ways that people are said to have suboptimal levels, and I won't go into all those right now, but none of those are situations that need medication. Some people may be given them, sometimes they may be helpful, but just know they're not needed, and that's the important thing to consider here. So if you're on the meds and you don't need them, can you ever go off? Well, if you need them, if you're in those categories, then no. But in all cases besides those who need them, many can taper, and many of those who can taper can come off. About 84% can take less, and about half can move down to none. You wouldn't want to really try for that if you're pregnant or nursing. Those that have the best odds of reducing a lot are those, this is kind of a weird one, but those who have a family history of thyroid disease. It actually means you're less likely to need long-term treatment. I wouldn't have guessed that, but it's true. Also, those that have been on treatment for shorter periods of time, like less than 4 or 5 years, those that are on lower doses of medication, and those who have stable TSH levels. I want you to hear this. If those don't apply to you, I'm not saying that it's impossible for you to reduce or stop meds. Those are just predictive. But there's a lot of people, even to whom those don't apply, who have been able to reduce or come off. So talking about how to optimize meds, the first thing to understand is, well, if you just started them, maybe they haven't had enough time yet. So how long does levothyroxine, how long does natural thyroid, how long do these things take to work? For starters, I'm going to talk about levothyroxine, and this would apply to Synthroid or Tirosint or any other medication that contains just T4. T4 is metabolized pretty slowly. And what that means is the initial benefits might take 2 to 6 weeks for even the first signs to show up. And the full effects, they could take a couple months or even longer. Now, when we talk about how long they take to work, we want to think about what kind of symptoms we're referring to. Some symptoms by their nature can clear up faster than others. A strong example could be your bone density. Even if something could change your bone metabolism, your bones don't regrow overnight. It can take years. Other symptoms like energy levels or mood, they could change pretty fast. Hair is a slow symptom. Tendinitis or muscular health, those are slower symptoms. Mood symptoms, energy, those are faster symptoms. So yeah, some symptoms, even in perfect scenarios, will take a while. Then we think about your blood levels stabilizing. So if you're measuring T3, T4 levels, that can take about 6 to 8 weeks to stabilize on a T4 medication, and about 3 to 4 months for the TSH. Now, if we're talking about natural desiccated thyroid or a combination of T4 and T3, sometimes initial changes can occur more quickly, maybe even in the first few days or week, and might take about 3 weeks for initial changes. And that by initial, I mean just some sign that something is different. The full effects for the more subjective, quicker symptoms, that can easily take a couple months, a little bit faster. The time frames for blood level changes are a little bit faster here because there is some T3 in the mix. So now it could be like 6 to 8 weeks, but still about 3 to 4 months for TSH to stabilize. So what are the signs that your thyroid medication is working? Well, first one is that how much you're taking is reasonable per your body size. There's a lot of math and numbers here. I've gone into that elsewhere. I'm not going to do it right now, but I'm going to share a link to a calculator that I made. You can just plug in age, size, and gender, and it'll say, here's about how much medication you would need. Some people are on doses that are much higher than that. If you're on less, that's totally fine. But if your dose is much higher, then one would predict based upon your body size, something ain't right. It could be that you're not absorbing it, you don't need it, or any other number of things. But that's the first sign to know if your dose is working properly. Next would be that your blood levels are stable. They're normal, they're in a reasonable range. And then most importantly, that your symptoms that you had that were ascribed to thyroid problems, that they've cleared up, that they've gotten better. And then conversely, we can think about how do you know if your thyroid medication is not working? Well, kind of the opposite of a lot of those. So back to the dose thing again, if your dose doesn't make sense, if it's way higher than would be expected per your body size, that's not right. Or if your levels are not stable, if they're always fluctuating. Now, a quick point about this one, if your thyroid levels are unstable, there's any number of things that could be a problem, but a big thing to think about is how you time your thyroid blood tests. I'm going to have a link in the blog, but the short version is that you've got to do your blood tests in the morning between about 7 to 9. You've got to test before taking your thyroid medication. You've got to draw your blood before taking your thyroid medication. You want to test after fasting. You want at least a 3-day break from all supplements before doing your thyroid blood tests, and you want to time it properly with your menstrual cycle. So the first 9 days, day one being the first day of your period, first 9 days are fine. Last 8 days are fine, but in between, not so much, pretty hit or miss. So those are also things that can make your levels not stable. And then of course, you want to make sure your symptoms are really well managed. And we're thinking about whatever symptoms you had before going on treatment. Weight, fatigue, hair, mood, it's all critical. And they could be coming from other reasons, but if they are, you should know that. And if you're told the thyroid's to blame, then you should see that resolve. Now, here's the big thing that I want to just put some more depth in is I talked before about who does and doesn't need medication. You can have levels of abnormal thyroid hormones that can cause symptoms. Yet that doesn't mean medications will help those symptoms. The only situation is where even when you need medication, it may not completely do the same thing your body did. So medicines don't always help symptoms. And especially those that have mild to moderate hypothyroidism, the odds are that even if your thyroid is causing these problems, the medications are unlikely to help those problems. And that's not intuitive. That's something that it's easier to assume that if a lack of a hormone is causing a problem, then replacing a hormone would help the problem. But here's the thing, in mild to moderate hypothyroidism, it's not a lack of hormone. It's a higher signal telling the gland to work, but the gland is still working. So there is a disease process taking place behind the scenes. That's where the symptoms are coming from. They're not coming from a lack of hormone. And that's a big pearl. I really want you to think through on that. This is why so many people are put on thyroid medications and they don't seem to help because their issue never was a lack of thyroid hormone, even if they had a higher TSH or something was said to be suboptimal. So if you're on meds and you're kind of just trucking along, what are the symptoms that you're not getting enough medication? Well, there's many, but possible hypothyroid symptoms are the classics, fatigue, weight gain, anxiety, insomnia, constipation, infertility, high cholesterol. Now, I want to expand that, of course, these can come from other reasons. And again, unless you need medication, medications may not be the answer to those symptoms. So the opposite side is, what are some possible symptoms if your thyroid medicine is too high? This is weird. This is a weird one. So the top two symptoms of too much medication, or top three symptoms, let's say, weight gain, fatigue, hair loss. Let me rewind. Top three symptoms of too little medication, weight gain, fatigue, hair loss. Top three symptoms of too much medication, weight gain, fatigue, hair loss. Is that wild? It's true. And I've seen this cycle happen so many times to where a doctor means well, someone doesn't feel good, they're on too much medication, and they've got fatigue, weight gain, or hair loss. And the doctor either doesn't bother testing or has reasons why they wish to disregard the tests. And they say the real answer is more medication. And here's a wrinkle. Sometimes it seems to help at first, but it doesn't give lasting benefit. So yes, you can have the same symptoms of too much and too little thyroid medication, the same exact symptoms. Other symptoms that can go with too much can include diarrhea, tremors, sweating. I mentioned the palpitations. Those can be a little more distinct, but a lot of the common symptoms are exactly the same on too much or too little. And this is why the symptoms are important, and albeit they are what matters, but we need labs to know which way to go. The symptoms don't tell us which way to turn. We need further guidance than that. So then putting this together, how do you know if your medication needs to be adjusted? Well, you've got some symptoms of too much or too little. You've got blood levels that are abnormal, some combination of those things. What if your blood levels are abnormal, but you feel fine? That's an important distinction. It still matters. If your blood levels are outside of range, and the most common scenario where this comes up is the TSH is below range, it's a risk factor. If you feel fine with that, it's still a risk factor. If you only feel well with your TSH below range, it means there's some other thing affecting you. And you can kind of push through or mask symptoms, especially fatigue symptoms, by overdosing on thyroid. But that's not the answer. That's like taking a stimulant. It can make you more energized, but it's not helping you. It's a risk for you. So yes, if your levels aren't right, even if you feel okay, that's going to cause dangers for you down the road. It's going to raise risks. But if you're not feeling right as well, then that's important, even if the levels are okay. So they both must be taken into account. So where should your thyroid levels be on medication? Well, there's where must they be and where can they be. I'll share some stuff about normal and optimal. I'll get some tables about that. But basically, if you're feeling well, it's okay if you're anywhere in the normal range. There's been a lot of pressure about these super narrow, rather unusual optimal thyroid levels. And where they matter is for someone who is normal but doesn't feel well, it's okay to adjust medication if they need it to move them into optimal ranges, as long as they're all still normal. But you don't have to be in these optimal ranges. You're perfectly fine to be within the normal. Just talked to someone yesterday, and this was her big struggle. She feels hyper when her TSH gets pushed down to low normal. But her doctor thinks that it has to be down to low normal because that's what everyone else says in natural medicine. I told her, no, it's fine. If the situation where you only felt well when it was low normal, then that would be okay. You could safely be low normal, but you don't have to be. So where you are in the normal range that works well for you is okay. Sometimes that's in a range that some would call optimal. That's fine. But you don't have to bend over backwards to get into some low, narrow, optimal range if that doesn't feel the best for you. Having said that, some push for high levels of T3, high levels of T4. That pretty much only happens at the expense of the TSH going below range because your body fights that. So that's one thing. This idea that you've got to be high range, no, you don't have to be. If you happen to land that way and your TSH was normal and you felt well and you were on reasonable doses, that's all fine. But you don't have to be. You've got options and people are different in those ways. So talking about your levels, How often should you check them? When you're on meds, how often should you check your thyroid levels? Well, there's two scenarios, one of which is that if things are not stable, if you had some of the problems we mentioned before, maybe you're tapering on medication or you're adjusting the dosage with your doctor. In those cases, I like to check between 1 to 3 months. Quick note, your TSH won't be stable in a month, but a savvy doctor can at least look at which way it's moving and how fast. And that way they can pivot more quickly if need be. But if things are off and you're changing, you want to check sooner. And if you make any change in a medication, it's nice to check in the short term. Once you're dialed in and things are steady, you can go less often. I don't encourage someone to go less often than twice yearly. So 6 months is about as long as you would want to go. Now, what tests are we talking about? Which ones are important? Well, the most essential single thing would be the TSH. If your thyroid antibodies have been abnormal, I would put those in the essential category as well. So especially if you're doing like frequent tests because things were off, those are really just the bare minimum. Those are appropriate and those are helpful. There are many times in which other tests can be useful for some individuals. That can include things like your free T4, your total T3, the other rarer thyroid antibodies like thyroid stimulating immunoglobulin, thyroid binding inhibitory immunoglobulin, that may include thyroglobulin itself or thyroid binding protein. There's other stuff that may be appropriate for some people in some situations. And that depends upon the details of your scenario and the input from your doctor. But quick recap. So thyroid meds, if you need them and they're mandatory for you, you've got to get them right. It's on your end, it's just taking a pill. It's no harder to take the right pill than the wrong pill. But the right pill in terms of kind of medication and dose of medication can be just life-changing, and the wrong one can be catastrophic. So you've got to get this right. Ultimately, this comes down to a relationship with you and a prescriber who gets all these things that I just said, and someone that you trust and feel good about working with. In other posts, I have and will talk more about which medications, other issues like that. But overall, that's really how to optimize and get them right, make sure they're working best for you. All right, Dr. C with you. Take great care. We'll talk more really soon.